This presentation is on hypothyroidism by Abby Johnson, Allie Burton, Carrie Harris, and Michelle Horton. Learning objectives. After attending the presentation, the learner will be able to define hypothyroidism with 90% accuracy, list 3 common symptoms of hypothyroidism with 90% accuracy, list 1 blood test used to diagnose hypothyroidism with 90% accuracy, list 2 interdisciplinary departments used for the care of a patient with hypothyroidism with 90% accuracy, list 2 risk factors related to hypothyroidism with 90% accuracy. Learning objectives continued. Describe 1 plan of care related to hypothyroidism with 90% accuracy. Give 1 example of how hypothyroidism impacts the patient, family, and community with 90% accuracy. Give 2 examples of how hypothyroidism can cause ethical issues with 90% accuracy. The location of the thyroid is right below the larynx. The definition and description of hypothyroidism is a condition in which your thyroid gland doesn't produce enough of a certain important hormone. Your thyroid gland is a small butterfly-shaped gland situated at the base of the front of your neck, just below your Adam's apple. Hypothyroidism develops when the thyroid gland fails to produce or secrete as much T4 as the body needs. Women, especially those older than age 60, are more likely to have hypothyroidism. T4 regulates functions such as heart disease, digestion, physical growth, and mental development, and insufficient supply of hormones can slow life-sustaining processes, damage organs and tissues in every part of the body, and lead to life-threatening complications. If left untreated, hypothyroidism can cause a number of health problems such as obesity, joint pain, infertility, and heart disease. When your thyroid doesn't produce enough hormones, the balance of chemical reactions in your body can be upset. Hormones produced by the thyroid gland are T3 and T4. T3 and T4 have an enormous impact on your health, affecting all aspects of your metabolism. T3 and T4 maintain the rate at which your body uses fats, and your carbohydrates help control your body temperature, influence your heart rate, and help regulate the production of proteins. Causes. Some causes include autoimmune diseases, treatment for hypothyroidism, radiation therapy, thyroid surgery, and certain medications. Hypothyroidism results when the thyroid gland fails to produce enough hormones. The thyroid is regulated by another gland called the pituitary, which is located in the brain. Hypothyroidism is a very common condition. Radiation therapy is used to treat cancers of the head, neck, and can affect your thyroid gland and may lead to hypothyroidism. Medications can contribute to hypothyroidism. 1 medication that can affect the thyroid gland is lithium, which is used to treat certain psychiatric disorders. If you are taking medications, ask your doctor about its effect on your thyroid gland. Less common causes of hypothyroidism. Congenital diseases in which some babies are born with a defective thyroid gland or no thyroid gland. Most of the time, the thyroid gland didn't develop normally for unknown reasons, but some children have an inherited form of the disorder. Often infants with congenital hypothyroidism appear normal at birth. Most states are now requiring that newborns have thyroid screening since the baby showed no signs and symptoms at birth. Pituitary gland is a relatively rare cause of hypothyroidism. Pregnancy sometimes causes women to develop hypothyroidism during or after pregnancy, postpartum hypothyroidism. This often occurs because they produce antibodies to their own thyroid gland. If left untreated, hypothyroidism increases the risk of miscarriages, premature delivery, and it can also seriously affect the development of the fetus. The thyroid needs iodine to produce thyroid hormone. Your body does not make the iodine you need, so you need to get it through your diet. Iodized table salts are rich in iodine. Other food sources of iodine include shellfish, saltwater fish, eggs, dairy, and produce and seaweed.
autoimmune diseases that can have an effect on your thyroid. It occurs when your immune system produces antibodies that attack your own tissues. People who develop a particular inflammatory disorder known as Hashimoto's thyroiditis have the most common cause of hypothyroidism. Thyroiditis is an inflammation of the thyroid gland. Some scientists think a virus or bacterium might trigger the immune response, while others believe a genetic flaw may be involved. Either a virus or bacterium affect these antibodies and thyroid's ability to produce hormones. The incidence of hypothyroidism. Thyroid disease is much more common in females than in males, with the reported prevalence ranging from 2 to 8 times higher in females. Hypothyroidism is more common in women with a small body size at birth and low body mass index during childhood. The frequency of hypothyroidism, goiters, and thyroid nodules increases with age. It is most prevalent in elderly populations, with 2 to 20% of older age groups having some form of hypothyroidism. It is 5 times greater in persons aged 80 and older than in individuals aged 12 to 49 years. Prevalence of the hypothyroidism was higher in whites and Mexican Americans than in African Americans. African Americans tend to have lower median TSH values. Risk factors. Women older than age 60, if you have an autoimmune disorder, have a family history of thyroid disease, have other autoimmune diseases such as rheumatoid arthritis or lupus, a chronic inflammatory condition, have been treated with radioactive iodine or anti-thyroid medications, received radiation to your neck or upper chest, have had a thyroid surgery such as a partial thyroidectomy, have been pregnant or delivered a baby within the last 6 months. Okay, so that's a picture of the thyroid system from the top to the bottom, basically, where it's produced. Pathophysiology. Levels of thyroid hormones are regulated by a complex feedback system involving the hypothalamus and pituitary gland. Localized disease of the thyroid gland is the most common cause of hypothyroidism. Under normal circumstances, the thyroid releases different forms of the hormone. Early in the disease process, compensatory mechanisms maintain T3 levels. Decreased production of T4 causes an increase in the secretion of TSH by the pituitary gland. TSH stimulates hypertrophy and hyperplasia of the thyroid gland. The hypothyroid changes in the heart result in decreased contractility, cardiac enlargement, pericardial effusion, decreased pulse, and decreased cardiac output. In the GI tract, and prolonged intestinal transit time with gastric stasis can occur. Delayed puberty, anovulation, menstrual irregularities, and infertility are common. TSH screening should be a routine part of any investigation into menstrual irregularities or fertility. Decreased thyroid hormone effect can cause increased levels of total cholesterol, and it may result in an increase in insulin resistance.
Okay. These are just some signs that you have an underactive thyroid: unexplained weight gain, constant fatigue and tiredness, high cholesterol levels. Signs and symptoms. The signs and symptoms vary of hypothyroidism, vary depending on the severity of the hormone deficiency, but in general, any problem you have tends to develop slowly, often over a number of years. At first, you may barely notice the signs of hypothyroidism, or you may simply attribute them to getting older. But as your metabolism continues to slow, you may develop more obvious signs and symptoms. The signs and symptoms of hypothyroidism are fatigue, sensitivity to cold, constipation, dry skin, weight gain, a puffy face, hoarseness, muscle weakness, elevated blood cholesterol level, muscle aches, tenderness and stiffness, pain and stiffness or swelling in the joints, thinning hair, heavier than normal menstrual cycles, slow heart rate, depression, and impaired memory. When hypothyroidism isn't treated, signs and symptoms can gradually become more severe. Constant stimulation of your thyroid gland to release more hormones can lead to an enlarged thyroid, also known as a goiter. In addition, you may become more forgetful, your thought process may slow, or you may feel depressed. Advanced hypothyroidism is known as myxedema. It's rare, but when it occurs, it is life-threatening. Signs and symptoms of myxedema include low blood pressure, decreased breathing, decreased body temperature, unresponsiveness, and even coma. In extreme cases, myxedema can be fatal. Hypothyroidism in infants. Babies born without a thyroid gland or a thyroid gland that doesn't work properly may have few signs and symptoms. The signs and symptoms in infants may include yellowing of the skin and eyes, also known as jaundice, frequent choking, a large protruding tongue, a puffy appearance of the face, constipation, poor muscle tone, excessive sleepiness. When hypothyroidism in infants isn't treated, even mild cases can lead to severe physical and mental retardation. This is just a diagnosis of how hypothyroidism is diagnosed. It starts with the serum TSH, and they kind of go from there, depending on if it's elevated or if it's suppressed or if it's a normal finding. The diagnosis and prognosis. Diagnosis is based on symptoms and the results of the blood test that measure the level of TSH and sometimes the level of the thyroid hormone thyroxine. A low level of thyroxine and a high level of TSH indicate an underactive thyroid. That's because your pituitary produces more TSH in an effort to stimulate the thyroid gland into producing more thyroid hormone. Because the TSH test is best screening test, TSH tests also play an important role in managing hypothyroidism. They help your doctor determine the right dosage of medication, both initially and over a period of time. TSH tests are used to help diagnose a condition called subclinical hypothyroidism, which usually causes no outward signs and symptoms. The ethical issues. Severe hypothyroidism can cause impairments with driving, operating heavy machinery, and decision making. The reason for the driving and the operating heavy machinery is because with hypothyroidism you do experience extreme fatigue, and with that puts you not at 100% yourself, and therefore you're more at risk for making mistakes while driving or operating heavy machinery. In decision making, patients with hypothyroidism experience more forgetfulness, and therefore they may not be able to make decisions like they once were. As a result, this can cause an ethical dilemma in HIPAA and public safety. With HIPAA, you want to keep your patient's information confidential, but when they're becoming a harm to themselves and the public, you have to think for your patient and try to get them help whenever they are acting in a way that causes harm to themselves or to others. Impact on the patient. They have lifelong medication. Unlike the flu or pneumonia, with hypothyroidism, it doesn't go away. This isn't something that's going to resolve over a couple of weeks or a few days. This is going to be a lifelong process, so they're going to have to take medication as prescribed by the doctor. Frequent testing. Once a patient is diagnosed with hypothyroidism, they need their TSH levels tested. Starts out once every 2 or 3 months, and then once they get the correct dosage, they'll be tested yearly just to ensure that that dosage is still correct for that patient. Transparency is imperative that the patient is transparent with the doctor and let them know how they feel, because with hypothyroidism, as stated earlier, it causes a lot of problems with joints and also with the heart. So if there's issues going along with the heart or if they're depressed, they do need to let the doctor know, because this can help them treat them better so that they can have a longer, fuller life. And lifestyle modifications. I stated earlier that they can't operate heavy machinery or do a lot of driving sometimes. Therefore, they may have to change jobs, and that sometimes can take away a lot of freedom that no one wants to give up. So the lifestyle modifications that are with hypothyroidism sometimes have to be implemented, but there's a lot of support, and the family, the patient can get through this as well. Impact on the family, they have testing as well. The testing for the family is every 3 to 5 years, and this is just because it tends to run in families occasionally. So they are tested every 3 to 5 years, and sometimes more often if they have signs and symptoms of hypothyroidism. The support, a lot of times people with hypothyroidism are not able to get up and do things they once were able to do. Therefore, it's important that the family is there to support them and pick up the slack where they're kind of not able to do what they once were. And caregiver role strain, this is just when somebody with hypothyroidism, they may go through a lot of depression and feel fatigued and lethargic all the time. They're not able to get up and do things that they once were. This can put a bit of a strain on the caretakers. And the impact on society is an unknown risk for harm, because sometimes it's really hard for us to give up our independence if we do have to give up driving or something like that. So they're at an unknown risk of harm when these patients are out driving around and they're not supposed to be anymore. And also with community support groups, because it helps to have someone to talk to when you have hypothyroidism, such as any disease. If you're going through anything together, then it's always nice to have somebody that can relate to what you're going through.
Plan of care for a patient with hypothyroidism. Our top 5 nursing diagnosis. At number 1 would be decreased cardiac output related to changes in stroke volume. Deficient knowledge related to new disease process is evidenced by limited questioning and or verbalization of lack of information. Deficient knowledge related to new medication is evidenced by limited questioning and lack of information. Disturbed sensory perception, specifically visual, related to the transmission of sensory impulses as a result of exophthalmos. Imbalanced nutrition, less than body requirements related to anorexia. Our up to 10, we've got constipation related to decreased peristalsis is evidenced by hard-formed stools. Impaired verbal communication related to tissue edema, such as a goiter, as evidenced by hoarseness. Low self-esteem related to changes in physical appearance and activity intolerance. And activity intolerance related to generalized weakness. And last, we have ineffective health maintenance related to inadequate funding, as evidenced by concern for medical expenses. We're going to discuss the top 5 nursing diagnoses with a plan of care. So first we have cardiac output related to changes in stroke volume. Our goal is to maintain cardiovascular function optimally characterized by blood pressure and heart rhythm within normal limits. Our interventions for this would be to assess and educate client on importance of monitoring heart rate and blood pressure. Assess and educate on process of monitoring heart rate, and an example of that would be to count the radial pulse for 1 full minute. Electronic blood pressure monitoring. And last, we have educate patient on signs and symptoms of adverse cardiac events such as chest pain, mental status changes, and a change in urine output. Our rationale for this would be client education should occur upon diagnosis. With hypothyroidism, client runs risk for development of chronic arteriosclerosis. Education on prevention and monitoring for events could prevent the debility from occurring. Next, we have deficient knowledge related to new disease process, as evidenced by limited questioning or verbalization on lack of information. Of course, our goal would be sufficient knowledge in the disease process and management of hypothyroidism. Our interventions would also be assess and educate patient through verbal interaction and written material on disease process and management of hypothyroidism. Evaluate knowledge through questioning and feedback of understanding. Our rationale for this would be adequate understanding of chronic illness will result in better management of health and decreasing risk factors for further illnesses related to this diagnosis. Next, we have deficient knowledge related to new medication as evidenced by limited questioning or lack of information. Again, our goal would be sufficient knowledge in medication used in treating hypothyroidism. First, we would assess and educate patient through verbal interaction and written material on prescribed medication for hypothyroidism. Then we would evaluate knowledge through questioning and feedback of understanding. Our rationale would be an adequate understanding of medication will result in better management of disease. Our next one is disturbed sensory perception, specifically visually, related to transmission of sensory impulses as a result of exophthalmos. Our goal is to identify sensory abnormalities, preserve vision, and symptom management for exophthalmos. Our interventions would be to educate and assess for signs and symptoms of exophthalmos, such as bulging eyes, decreased field of vision, excessive tearing, and impaired ability to close eyelids. We would educate and assess client for symptom management such as decreasing salt intake, sleeping with the bed elevated, and wearing dark glasses when around lights. Our rationale would be ensuring adequate knowledge in signs, symptoms, and treatment of exophthalmos can decrease risk for long-term corneal damage or decreased sensory function. Next, we have imbalanced nutrition, less than body requirements, related to anorexia. Our goal would be that the client will maintain BMI within designated range and understand nutritional needs for hypothyroidism. Our interventions are to assess the client's weight, appetite, and review a 24-hour food diary. Educate the client that weight gain is caused by a slower metabolism that comes with hypothyroidism. With initial hormone replacement, there will be weight loss, but the client will need to have a low cholesterol and low saturated fat diet to maintain a healthy weight and digestive system. Our rationale for this is the client's weight and nutritional intake will need to be monitored related to the decreased metabolism from hypothyroidism. Client understanding of dietary restrictions will prevent the weight gain associated with the disease and therefore preventing image issues. Client will need to monitor fiber to ensure digestive tract stays mobile and constipation will not occur.